Thank you, Dilek and Ishol. What an interesting case study you guys have shared. Now I will go into my presentation. Hello, everyone. My name is Soohyoun Nam, and I am a journalist at JoongAng Daily. It is one of Korea's leading daily newspapers. And here I am covering the country's healthcare system and related policies. As a journalist who is always concerned about how I can contribute to making a more patient centered healthcare system, I am truly happy to speak and participate here at APPIS. Today, I would like to talk about how patient groups can better engage with the media to shape policies and laws that advocate for patient rights. More specifically, I'm going to share the story of a patient organization in Korea, which succeeded in finally passing a bill which it had advocated for many years. There are many different stakeholders in healthcare, but the most important one, the patient's voices, are sometimes not given enough attention it deserves in the media. I hope that my presentation will provide some useful insights into how patient groups can have bigger influence in the media and thus achieve the goals they want. Before we get into the details, let's take a quick look at the dynamics of policy shaping in Korea. This diagram shows how different groups involved in an issue interact and influence each other, with the thicker arrows showing stronger influence. In Korea, patient groups have the potential to influence various stakeholders, but traditional media, like the newspaper, still plays a big role in sparking social discussion and shaping public opinion. I would describe the media as a kind of a loudspeaker that can amplify the voices of patient groups to reach the government or the National Assembly. Since the policymakers are quite sensitive to issues that are raised by the media, it's important for patient organizations to have a strong voice in the media if they want to make some long lasting changes in the healthcare landscape. Now let's dive into the legislative success story of Korea's leading patient organization, the Korean Alliance of Patient Organizations, in short, KAPO. As of last September, Korea has become the only country in the world where all operating rooms are mandated to install surveillance cameras to secure patient safety. This was possible because a bill passed the National Assembly 2 years ago, thanks to KAPO's efforts. As you might easily expect, the bill to install cameras in surgery rooms has sparked a lot of social debate and fierce opposition from the doctors. But patients, led by KAPO, have called for the bill for about 7 years, as there have been too many cases of patients dying or being injured during surgery due to doctors' misconduct. The journey to pass the bill began in 2014 when a high school girl died after undergoing plastic surgery. It turned out that an unqualified doctor performed the surgery. This so called ghost surgery, where an unqualified medical staff performed the surgery while the patient is put under anesthesia, was rampant in Korea during this time. Although there were some media coverage in 2014, the issue quickly faded away. Then in 2014, another incident occurred where a patient named Kwon Dae-hee died of a hemorrhage due to similar ghost surgery. Frustrated and grieving the loss of her son, the mother decided to step up to take action to prevent such incidents from happening again. Mrs. Lee was fortunate enough to obtain footage of her son's operation, and she reviewed it for about 100 times and revealed that the medical staff did not take proper measures to control the excessive bleeding. Without the footage, it would have been impossible to prove the malpractice of the medical staff, and thus Mrs. Lee's story was a powerful grounds to require cameras in surgery rooms. Ms. Lee reached out to Capo for assistance, and Capo started to call for the Surveillance Camera Act, actively engaging the media too. Due to strong opposition from the doctor's side, the bill was discarded many times. But Capo's efforts lasted during those years, and after 7 years since the necessity of such law was first raised, the bill finally passed in 2021. How was Capo able to keep this agenda alive in the media? Here are a few efforts made by Capo. The most basic and quantifiable effort is the volume of press releases. Over the 6 years, Capo has issued a total of 91 press releases related to this issue. And according to a research which analyzed every press releases distributed by Capo since its establishment in 2010, the most frequently mentioned keyword was operating room and surveillance camera. This shows how persistent Capo was with this particular issue. Moreover, according to an analysis conducted through AI, out of all articles published related to this issue, 59% either contained Capo's press release or was written after interviewing Capo. This shows how much influence Capo had in making articles published on this agenda. Capo also organized events for patients to speak out. These were so-called shouting cafe, where the patients could literally shout about their cases in which their rights had been violated. Capo invited journalists and experts to this event with the goal to seek solutions for the problem rather than just having patients to speak out. Shouting cafes were first held in 2012 and has continued for about 10 years. During this time, many patient rights agenda spotlighted in the Korean society were first raised at this event. Kwon's mother, Miss Lee, also spoke to the public about her son's death at Shouting Cafe. This shows that events organized by patient groups become valuable sources for the media. Capo also actively advocated and lobbied in the National Assembly, collaborating with lawmakers to hold policy seminars. And the families of victims also joined Capo in directly explaining their positions to the assembly, even holding protests in front of the assembly for 100 days. When I interviewed Mr. An Gi-jong, the representative of Capo, he emphasized the importance of consistently voicing the concerns of patients. At first, patients might be disappointed at people's indifference, but if you just don't let go of the advocacy effort, someday patient rights will be guaranteed. Based on what I learned from the interview with Mr. An and from my perspective on this issue, I would like to summarize the key success factors of Capo's advocacy in 3 points. Firstly, the most important aspect is the patient group's advocacy is that patient groups advocacy at first should be based on the genuine stories of the patients. Concrete and vivid narrative serves as powerful sources that can influence the media, public opinion, and ultimately the policymakers. Genuine stories are also important because the stories themselves can serve as evidence to support patients' arguments. In case of surveillance cam installation law, Mrs. Lee's efforts were crucial to the passage as she had replayed the footage of the surgery that killed her son more than 100 times to prove the malpractice. The press can't just write about a story just because it's heartbreaking. But when backed up with stories with solid evidence, it can gain bigger coverage from me. Secondly, as mentioned by Mr. An, the representative of Capo, it is crucial to advocate persistently. It is a challenging task for patient groups to advocate for a single issue for over 7 years. There may be moments of frustration and a sense of being unheard. Mr. An said it's rather more efficient to take a break from raising an issue when the public's attention cools down. The moment to raise the agenda will eventually return, and that's when patient organizations should proactively engage with the media again. Lastly, I would like to emphasize the importance of providing media with sources for reporting. For instance, presenting survey results that show strong support for the issue. Creating platforms where patients can share their stories, like press conferences and events like the Shouting Cafe. Journalists are constantly seeking stories. By providing them with a clear standpoint and tangible sources, it can result in impactful news coverage. I would like to conclude my presentation here. I want to once again emphasize that journalists are always eager to listen to patient stories. If patients continuously call for what they want, the press will also recognize its importance and will eventually publish it. So don't give up and be more active in building relations with the media. I hope my presentation was helpful in creating an environment where patients can receive better and safer treatment. Thank you.